I'm incredibly proud of the nurses that work in the Mount Sinai Health System.
Our input means something. We have a voice, and we are heard, and we're loud.
Our patient-centered care, that is a culture. I mean, this is what we do.
The future of emergency nursing will look different, and the Mount Sinai Health System is evolving the profession daily to help meet those future needs. Mount Sinai Emergency Services relentlessly advances care for all by creating an environment to support the well-being and education of emergency nurses. There is a unique energy driving the professionals at Mount Sinai Health System, and emergency nurses are at the center of it all.
They are persistent, they're gritty, they're smart, they're incredibly talented.
We are. We are. It takes a special person to get up in the morning and not know how the day is going to be going. I feel nurses are the heart of the ER.
And they're the lifeblood of what's called the relationship-centered care model.
Our nurses are laser focused on doing everything that they possibly can to engage our patients and their families in their experience while they're in the emergency department.
What I value is building that relationship, that rapport. That's what I talk about patient-centered care. It's me, the patient, and the relationship we're going to have. I build relationships with families.
It's about positive patient outcomes and advancing care, all while improving the lives of the healthcare team.
For me personally, if I can't take care of myself, how can I take care of someone else? So I tell my nurses, take care of yourself, take time for yourself, because we all have those burnout moments.
The mental state has to be sharp. You can't be checked out and be an effective nurse.
We have yoga, we have a therapist, because sometimes we need that person to talk to. There's no shame in asking for help. The shame is not asking for the help.
And for the inevitable tough days, there's the relaxation room.
It allows you to kind of shut out the chaos. You get a little bit of time, recenter yourself.
There's been an enormous focus on wellness and trying to create a better quality of life for all of our staff.
To further empower nurses and help them thrive, they're ensured a seat at the leadership table.
We have a seat, but we also heard at the table. Our ideas affect the hospital.
Our frontline staff are doing the work and they understand what works and what doesn't work, so we do place a heavy emphasis on making sure that they have a voice.
Absolutely we do. Any leadership committee has employees and nurses. I was on the state-funded staffing committee. I'm on the magnet committee. These allow me to kind of go deep and go wide in what I do.
And that encourages frontline staff just beginning their career journey.
We have opportunities to either grow as a nursing education or a nursing management, because they would love to retain people who have been on the unit.
Retention and increasing the pipeline of nurses is an issue Mount Sinai is determined to help solve.
One of the ways that we're addressing it here at Mount Sinai is we've developed a new graduate fellowship program. So essentially, any nurse that graduates with a bachelor's degree from any nursing school in the country is free to apply to our program. Year to date, in the last 11 months, we've had a 99% retention rate.
Nursing fellowship program, it helped me immensely by making me feel more prepared.
Helping prepare emergency nurses for the future in a profession that is rapidly evolving is crucial.
We want to embrace you. We want to help you. We want to help you succeed, and that's so important. That's what I got 30 years ago.
The future of emergency nurses will translate to only the very sickest patients walking into a brick and mortar location, and I honestly believe that the rest of the care will be delivered in an ambulatory or outpatient setting, going back to making house calls and wearing headsets and having technology at their disposal to be able to take care of patients right where they're at.